the keys, and I want to tell you that Neil is a high schooler. When I was in high school, I was having a hard time keeping my nose clean. And this guy is presenting at ASNC, so congratulations.
Hi, my name is Neil Virna. I'm a senior at Phillips Exeter Academy. And my mentor for this presentation is Dr. Peter Shaw from the Elliott Heart and Vascular Center. And my presentation is on multimodality imaging in a patient with incidental cardiac mass. For this case, it was a 77-year-old male with no cardiac history, and he was evaluated in an emergency room for worsening dyspnea and palpitations. The EKG showed AFib with RVR, and chest X-ray showed features of heart failure. Laboratory findings include troponin elevated at 8,000. The image on the left is a CT for pulmonary embolism, with the red arrows showing mass in the right atrium, AV groove, and ventricular free wall, and the yellow arrows showing associated pericardial effusion. The two images on the right are echo images, the top of a subcostal 4-chamber view without echo contrast, the bottom of an apical 4-chamber view with echo contrast, both with the same red and yellow arrow designations. Next was cardiac MRI. The image on the top left is an SSFP image, pre-contrast showing cardiac mass with the red arrows and pericardial effusion, again with the yellow arrows. The two images to the right of that are T2 weighted and T1 weighted images, showing isointense to mildly hyperintense mass and isointense mass respectively. The two images on the bottom left are native T1 mapping and T2 mapping images, both showing elevated values. The final image on the bottom right is a post-gadolinium enhancement image, showing enhancement within the mass with the red arrows and pericardial effusion, again with the yellow arrows. Next is further imaging with the FDG PET. The image on the left is an FDG PET CT, showing avid FDG uptake in the right cardiac chambers. The image on the right shows avid FDG uptake in the paratracheal lymph node. Biopsy of this node revealed diffuse large B-cell lymphoma, for which he underwent POLA or CHP chemotherapy. Finally, the learning points. From this, we see that multimodality imaging is critical for diagnosis of cardiac mass. In this case, the presence of avid paratracheal node provided an easy target for biopsy to establish the diagnosis. Although tissue diagnosis is key, multimodality imaging provides clues to possible etiology of the mass. Thank you.